and we have many others that will be speaking this evening. So we're going to kick this off with Councilman Wendell Young. We're going to give us a few minutes. He's walking in. So we'll go through our speakers, and then we'll also have questions for anyone during the end. And we still have individuals that are coming. Welcome, welcome. We have some seats over here. That do not know me, I'm Zola Stewart. I am an Avondale resident, a business owner, and a proud citizen of Cincinnati. And I am a huge advocate for the health gap because it's so important. So we'll begin this evening with Councilman Wendell Young.
Good evening, everyone.
Good evening.
In case you missed it, my name is Wendell Young. I'm a member of Cincinnati City Council, and I'm glad that you're here this evening. We're going to talk a little bit about the budget that the city's working on, the carryover part of the budget. And this is the part of the budget where whatever we don't cover in the main body of the budget, this is where we try to make the corrections. This is where we try to fix the things that still remain broken. The budget that we propose at council is, in my opinion, a good budget. It's a budget that addresses our social service needs. It's a budget that addresses infrastructure needs. It's a budget, let's be honest, that has some people's pet projects in them. And it's the kind of budget that would not face any problem from a mayor when the majority of council supports it. However, the Center for Closing the Health Gap is in that budget. And that is the sticking point. And because the Center for Closing the Health Gap is in the budget, the mayor has vetoed the budget. In other words, the mayor has decided to throw a grenade into the middle of all the hard work that council did. And he's doing that on the pretense of believing that council is not being frugal with the citizens' money. That council is wasting money by supporting the very kinds of programs that people are constantly on this council to support. We are slowly moving toward being able to fund social service programs in our budget at the promised 1.5% of the budget. 1.5%, and we still can't get there. But again, like I said, it's the Center for Closing the Health Gap that's the sticking point. Now, why do I take such issue with this? A couple of reasons. One, I'm a very good friend of the Center for Closing the Health Gap. But you don't get my friendship just by saying you do good things. You have to show me. So I've had the opportunity to see what the Center for Closing the Health Gap does in our community. Now, I recently had a health scare, and it cost a lot of money to keep me here. The Center for Closing the Health Gap is in the budget for $750,000. I happen to think I'm worth at least that much. But $750,000 given to the Center for Closing the Health Gap saves more than one life. There are multiples of lives saved by the health gap every day. There are people in our community who will tell you, I didn't know I had high blood pressure. I didn't know I had heart trouble. I didn't know I had this or I had that. It's the Center for Closing the Health Gap that's able to address that. Now here's another important thing about the center. Some people will have you say, well, they can just go to a doctor and discover the same thing. But the trick is, how do you get them to go? You see, in our community, we have a long memory. And everything we remember about the healthcare industry isn't good. And so sometimes it takes more than a person in a lab coat wearing a stethoscope to convince us that we should get a checkup, that we should go to a doctor. One of the things the Center for the Health Gap does is it works one-on-one with people. And that is a tried and true approach. Name anything you've ever done where at some point in your life you didn't rely on the advice of somebody you trusted and believed in to tell you it was a good thing to do what you're contemplating. You see it every day on TV. You wanna buy a car, you wanna buy clothes. You think those celebrities are there endorsing those products just for the fun of it? Everybody knows personal endorsements work. And so when someone from the Center for Closing the Health Gap approaches you, you're more likely to listen and more likely to do what's important. Eat right, do right, work in churches, work in schools, work with corner stores, every kind of way you can think of in our community. So why wouldn't you support something like this? In all honesty, I don't know. Not long ago, John Cranley not only supported the health gap, he cut a commercial in which he extolled the virtues of the health gap. He talked about the very things I'm telling you, how the Center for Closing the Health Gap saves lives. And he urged people in that commercial to support Dwight Tillery and the Center for Closing the Health Gap. So what happened? What changed? Well, Dwight Tillery decided that he wouldn't support the mayor for re-election. That's what's changed. And after that happened, suddenly, the Center for Closing the Health Gap couldn't do anything right. Suddenly, the mayor believed that it was necessary to have the center investigated because he believed the center was not spending your money correctly. Now, that investigation was really an audit, and it turned up nothing. In fact, the most important thing it turned up was that the city needed to tighten up on what it does, not that the Center for Closing the Health Gap was wasting money. But that's not enough. Then John Cranley went to the board for the Center for Closing the Health Gap, and he told them, basically, if you don't get Dwight Tillery in shape, there are gonna be consequences. And then not long after that, there was $750,000, nearly $1 million for the center. And the mayor didn't veto that. Well, I think maybe he didn't because there was an upcoming election. But now the election is over, and here we are again. Now, this is what I want to tell you in no uncertain terms. This is a situation where you have a mayor, who in most cities would probably be the most powerful elected official you have, using his position and his authority to settle a personal beef. Yep. Now, all of you have grown up, you all went to school. Do you remember the schoolyard bully? Do you remember how they operate? They have a beef with somebody, and rather than settle it on their own, they come out and round up a posse. The mayor wants city council to be his posse, to beat up on Dwight Tillery and destroy the health gap. This cannot be allowed to happen without me fulfilling what I think is my duty and letting you know that this is going on and making sure you understand I have no intention of being a part of the mayor's posse. Now, all of us in politics have our enemies. There are people who don't like us. And frankly, there's some people we don't like. But I don't think you would like it if I used my position to get back at someone I had beef with. I think you would consider that small of me and petty of me. And I'm saying to you, those are the feelings I have about a mayor who would destroy an institution in our community just to get even with Dwight Tillery. So you need to understand that the Center for Closing the Health Gap saves lives. The mayor's action simply said he is willing to play Russian roulette with the health of our community just to settle a beef with Dwight Tillery. This is a man who has no respect for an institution in our community that has earned its way in our community, that does the work it says it wants to do. He has no respect for that because he doesn't like Dwight Tillery. Aren't you glad Dwight Tillery is not the head of Children's Hospital? Can you imagine what that would look like? So ladies and gentlemen, that's why I'm here and that's why I stand here in front of you today. I want you to know that on Wednesday, the fight for the money to save the Center for Closing the Health Gap continues. I think I said Monday, but I meant to say Wednesday. And I would love for you to come, to be there at least by 1:30 or before if you wish to speak, but to come and speak on behalf of an organization that you know as well as I do is not only worthy of respect, but also worthy of support. And it can't happen unless people see that the Center for Closing the Health Gap is respected, that it's loved, that its work is appreciated by more people than Wendell Young, more people than Dwight Tillman. You and your friends need to come and support the center. I'm here to urge you to do that. I urge you to listen to the speakers who will follow me. And if you need to, I need you to do some homework on your own to see that you're not being lied to this evening. And that you not permit a mayor of this city to use their authority and their bully pulpit to attack still more black people. Do understand, this mayor has a problem with black people. And especially black people who disagree with him. And so I disagree, and I've had my turn in this barrel. And I can stand up here and I can name you names beginning with Milton Mahoney all the way up to and including myself. And in every case, it's been a black person. Save one white female at the park board named Diane Rosenberg. And he disagreed with her, and he tried to destroy her too. So I will tell you, Donald Trump lives in Washington. Many Trump lives in Cincinnati.
Thank you, Councilman Young. We now have Patricia Milton with the Avondale Community Council.
For the past 12 years, I served on the board of the Center for Closing the Health Gap. When the health gap started fulfilling its mission, no one was doing the work of health disparities. In fact, for over a century, many organizations ignored this civil rights work. I observed firsthand the grassroots work the health gap is doing. No other organization has hired and trained community people to work with community residents and empower them one-on-one to advocate for their health and well-being. We know without good health, you cannot enjoy your life, your family, your home, or your job. Because of the health gap's work, lives have been saved, and thousands of black residents now advocate for their health, active lifestyles, and the elimination of the social determinants of health, which plague our communities. Our neighborhoods have been neglected, left behind by budget spending decisions of our local politicians and business community. Don't be fooled, these decisions are made years in advance. I say to Mayor Cranley, black citizens and black children of Cincinnati have some of the worst health outcomes in the nation. Why is there a challenge to spend city budget dollars to benefit black residents? Mayor Cranley, why is there a mindset that black residents should accept the crumbs from the city budget? The budget should be equitable. Where is the equity? Mayor Cranley, all organizations should be held to a standard. The health gap has a proven track record that must be recognized. The work to benefit black residents should be funded, and not just funded through white organizations run by white executives.
Wow.
Any Cincinnati councilperson voting against the work of the health gap is an in-our-face vote against the black community.
Yes.
We must support our own organizations and not stand on the sidelines and wonder why we don't have more power and resources to do what we need to do in our communities. Now, why is the health gap being attacked by Mayor Cranley? The orchestrated attack on the health gap, supported by the Inquirer and WCPO, is the result of a threat made by Mayor John Cranley to our board chair, Mark Wendell. Cranley called Mr. Wendell in June of 2016 and told him that if Dwight doesn't cooperate, there will be consequences. 7 months later, after Cranley's threat, Mayor Cranley orchestrated a bogus, and I do say bogus, investigation in collusion with WCPO I-Team, Sharon Coolidge, and Dan Horn to destroy the health gap and Dwight Tillery. At our board meeting in June of 2017, Mr. Wendell shared that conversation with our board. Mayor Cranley shows his true colors in the consistent, blatant, and intentional racist attacks against former Mayor Tillery and other black leaders. It's not just an attack on Dwight. It's not just an attack on the health gap. It's not just an attack on other black leaders. It's a pervasive, racist attack on the black community, and it must be called out. Dwight has dedicated his life to justice, and his accomplishments show that. Thank you to Dwight, to the staff, to the board members, and all the supporters of the health gap for the work that you do.
I'd like to thank the health gap for the food deserts, addressing that issue. I don't know of another organization that does that. So thank you. Thank you for that. We now want to welcome Attorney Bennett Allen. Thank you.
Thank you. I think we're here because, as one of our council members recently put it, we need governance, not grudges. As most of you already know, the center is a nonprofit that uses a community-based participatory research approach to addressing the health disparities that exist within and between communities of color. As has been pointed out, our approach is recognized by the Kellogg Foundation as the approach needed to eliminate health disparities. Our track record speaks for itself, having been recognized by the Harvard School of Public Health, the Center for Disease Control, the Robert Wood Johnson Foundation, the American Public Health Association, and others. We've been awarded grants from the Procter & Gamble Foundation, Coca-Cola, Aetna, the American Heart Association, and the National Medical Association, among others. Yet, as you've heard, Health Gap's funding has recently been vetoed for the upcoming budget, purportedly based on a payment of less than $2,400 to our so-called political arm. Health Gap has no political arm. We solicit no political contributions, and we make no political contributions. This is a baseless attack on the organization. Our funding, as you've also heard, has been vetoed because our president and CEO shifted his support during the 2016 election from the incumbent to the insurgent. That's it. There's no other reason. And in fact, as you've heard, 2 of our board members were essentially warned, if not threatened, prior to the 2016 election, that if Health Gap's leadership did not, as you've heard, sort of shape up and come around, that there would be consequences. And what do you know, but less than a year later, we find ourselves subject to 2 audits, one by the state of Ohio and one by the city of Cincinnati. But neither audit found any evidence of any wrongdoing. No self-dealing, no excessive business holdings, no imprudent investments, no taxable expenditures, all of which are matters under the jurisdiction of Ohio's charitable law section. We even made our budget available to the press. And now that the audit's over, without an end to the attacks on our organization, we are calling for a special investigation into the political pressure leveled against Health Gap during the 2016 election. I am a former federal investigator with almost a decade of experience conducting criminal investigations, specifically financial crimes. And I have examined the state audit report, the city audit report, and I have examined the audit reports prepared by an independent accountant on an annual basis for the Health Gap. And I'm here to let you know that there is nothing in there that I found that raises anything even approaching the kinds of concerns and the kinds of, again, the baseless accusations and allegations that have been leveled against our organization.
Wow.
But I've been brought on board also to assist Health Gap in cooperating with any investigation that City Council might elect to undertake. And if there are any ongoing concerns that City Council has regarding Health Gap, I'm here to act as liaison to the city in those matters as well.
Wow.
And I assure you, we will not have any cell phones falling into hot tubs. No organization should be subject to political pressure or coercion based on who its leadership supports as private citizens in an election. The attacks on Health Gap are reprehensible and are not befitting of an elected official.
That's right.
This kind of vindictiveness has no place in politics. We need elected officials who want to govern our great city, not carry a grudge. Thank you.
We'd now like to welcome Bishop Bobby Hilton with the Cincinnati chapter of the National Action Network.
Wow, what else can be said? My goodness. You know, I have stood with Dwight Tillery for some years, stood with him, and stood with his work with the Health Gap, but I think it's very important that I state this. I know Dwight Tillery, we became acquainted, and we became close because of the work of the Health Gap, not the other way around. I didn't get to know the Health Gap through Dwight Tillery. I got to know Dwight Tillery through the Health Gap because I was one of the pastors in the community that as the Health Gap was doing their work and going out into the community, I pastored one of the churches that they contacted and said, we're doing this and we're doing that. We would like to partner with you all to bring some programs to the community to help the health outcomes of our people. We begin to listen to them. We begin to partner. The Health Gap set up programs in our ministry. The Health Gap helped us to put a garden on our property. The Health Gap helped us to do health programs in the church. And the Health Gap at the church I pastor helped us to hold a program where somebody in the community came and got tested. As a result of that testing, they were taken to the hospital, and the doctor said, had they not come that day, they would not have lived through the night. Right. That's why I stand next to the White Children. That's why I stand with the Health Gap. There's no question that health disparities exist in our community. There's absolutely no question that the Health Gap has labored over the years and been extremely successful bringing programs and working toward improving the health outcomes of our people. So now, why are we here? What is this really about? The only way that anybody can try to destroy the work of the Health Gap is to say that black lives do not matter. Well, I came to tell you, black lives matter. They don't begin.
White, mother and Health Gap employee.
So 3 months ago, I was struggling financially, not able to take care of my 2 daughters. As an employee of the Health Gap, who happens to be a single mother, the center has given me the opportunity to take care of my daughters and provide for them in a way where they are stable and they're able to have to grow and develop in a manner that I see fit and as you guys would see fit as leaders in the community. The denial of funding will not only impact me as a single mother, it will impact my coworkers former employees of the Health Gap, partners, volunteers, and the people that we work with, educate, empower to take initiative with their help on a daily basis. The Center for Closing the Health Gap's mission is to eliminate racial and ethnic disparities in Cincinnati, and that is what we work towards every single day. And when we don't get the funding we need, that impacts the lives of the citizens on the streets of Cincinnati. If you are fortunate enough to have the opportunity, it is your duty to make sure that others have opportunity as well. And denying the Center for Closing the Health Gap denies many people the opportunity to be empowered, as well as educated enough to take action in their own health, which impacts the health and wellness of our community.
We have Bomar, President of the Baptist Ministers Conference of Cincinnati.
I don't know that I would really call the mayor a racist, but I would in fact call him a very foolish man. And the reason for this is because, and it's been mentioned, and I'm really not saying much more than what others have said, but the reason for that is because he does not do, now he's supposed to be a Christian, and he doesn't do what the scriptures say do, that when you have an ought against your brother, that you go to him and you talk to him about it. And really that's what we call the mature thing to do. But this man tends to hold grudges with everybody that he has an ought with, instead of talking to them in a reasonable manner. And what he, I think, fails to understand is that he's not really hurting Dwight Tillery. He's hurting the thousands of black people that the Health Gap has helped over the years. And these people are the very ones that helped put him in office.
Yeah, that's right.
And so my concern for him is that if by chance he ever decides to run for office again, you have to take time out to realize that you hurt so many people.
That's right.
That you can't get that vote again. If by chance, I don't know what he decides to do, I think he may not, but if by chance he does decide to run again, he has hurt himself.
That's right.
He has burned the bridges that have helped him along the way. Dwight Tillery helped get him in office. He's burning that bridge. The people that helped vote for him, he's burning that bridge. And if I may say behind Bishop Hilton, that not only has the Health Gap done all of those things, but the Health Gap worked with us, the Baptist Ministers Conference, in making sure that there was a grocery store out in Bond Hill when Kroger's decided to leave.
Wow.
And so that what makes sure that there are fresh fruits and vegetables for the seniors that are not able to get around to shop at places far out. So we thank you, Brother Dwight Tillery, for the work that you've done.
Yeah.
And the work that you will continue to do. And I'll tell you why I'm saying continue, because I don't believe that the mayor can tear down what God has done.
We have Yanni Yarrell, Black business owner.
Good evening, everyone.
Good evening.
I am very honored to speak along with this distinguished panel to talk about my experience with the Health Gap back in the year 2002, I founded a company called Speedy Signs and Apparel. And what I quickly found out, like most entrepreneurs in this room, that running a business is a very difficult thing to do. In fact, statistics will tell you that 80% of all businesses fail in the first 5 years. And that's all businesses. So you can imagine what that means for Black-owned businesses. So after I was in business for about 6 years, I was still a one-man shop, struggling and wondering how much longer I was going to be able to keep the doors open. And somebody introduced me to Dwight Tillery. So shortly after that, Ms. Patricia Hilton came out and vetted us, because you know that Black, White, or Purple, if you have to have your game together for Ms. Milton to approve you. So we passed that vetting, and we formed a partnership with the Center for Closing the Health Gap. And I went from a struggling one-man shop to 5 years later, we had a staff of 5 people, which means I had 4 people employed who weren't employed before because of the health gap. We went from a 1,200 square foot building to a 3,000 square foot building, and now we're looking for a bigger space next year. So it's true that the health gap has helped a lot of people health-wise, but there's byproducts to that, to our community also. And I'm just one example of several Black businesses in this city who would not be in existence today had it not been for the health gap. Thank you.
I'd like to welcome Charlie Winburn, minister and former city council member.
I'm not requiring anybody to stand right now. I want to say something. Thomas Jefferson, our former U.S. president and founding father, and the principal author of the Declaration of Independence, Jefferson observed 2 types of enemies of the people: the criminals and bad government officials. Jefferson had the foresight to know that government can be a monster if the people running it are not tied down by the Constitution of the United States of America. Our city government has become the enemy of the people under the Cranley administration. I want to say it again. I want to be on the news tonight. That our city government has become the enemy of the people under the Cranley administration, and it is one of the most corrupt governments since Boss Cop. For the last 5 years, this government has used taxpayer dollars to punish their enemies and people that they do not like. Having African American leaders investigated by the media, the FBI, the auditor's office, the Ohio Attorney General, and some even say the CIA. The firing of the police chief, the firing of 2 African American city managers, Boxgate. They forced out our park director. They forced out our MSD director, MSD Gate, and the investigation of 20 African American leaders. They put the FBI, CIA, they put Sharon Coolidge, the inquiry on me, they put all that stuff on me, and they could not bring me down. All right. Because no weapon formed against me shall prosper. And they will try to eat up my flesh, and they'll stumble and they'll fall. And I'm going to tell you this, you can't lose with the stuff I use. And now the Cranley administration is punishing the African American community once again by working to close down Closing the Health Gap, the Center for Closing the Health Gap. Cranley was the first mayor to give $1 million to closing the city, for closing the health gap. And then he turned around and stabbed us in the back.
That's right.
And there's a reason for that. Why is the Cranley administration punishing the Black community? Why is Cranley doing this? He's only doing this for one thing. Because Mr. Tillery stood up to Mr. Cranley and said he was not going to endorse him for mayor.
All right.
And Mr. Cranley had told me that you better get Tillery in line. He wants a war, I'm going to give him one. I'm coming after him. I never told Mr. Tillery because I know Mr. Tillery will put his boxing gloves on and knock the literal hell out of him. Because Mr. Tillery stood up to Mr. Cranley and said he was not going to endorse him. The Cranley administration said, through their quick actions after they found out that Mr. Tillery was not going to support Cranley, it's time we investigate Mr. Tillery and destroy him in the media with investigations after investigations like he tried to do with other black leaders. The Cranley administration gives out millions of tax dollars to some of their very personal friends. That's right. Please, young man, y'all need to subpoena me. Bring the FBI in, I'll talk to them. I'll show where all Cranley's friends are, and I'll show you where all the money and all the network is. I'll show you what's going on. All right? So the Cranley administration gives out millions of tax dollars to some of their very personal friends who are not held accountable to the same standard of closing the health gap. I'm about through. Most recently, a city nonprofit overbilled the city $16,000.
All right.
And its director resigned in shame. And the Cranley administration turned their heads and did not punish them by closing them down in their nonprofit, because you know why you didn't do that? Because on their board, they had one of the lenders. And let me tell you, you don't mess with the lender family. Because guess what? I'm a part of the lender family. And he didn't mess with the lender family because the lender family will end up kicking your... Y'all fill in the blank. Finally, this administration honors their personal friends with government contracts, and they punish and they hurt and they harm their alleged enemies by denying them their share of their own tax dollars. And y'all need to understand this, that Mayor Cranley is the one who decided that I was his enemy, that Mr. Tillery is his enemy. He just wakes up one morning and decides who his enemies are, because we have never declared him to be our enemy. And the Bible says, love your enemies. Do good to those that hurt you. And finally, as I conclude, the Cranley administration, and y'all can write it down, quote it, put it out on Facebook, Twitter, Instagram, any gram you want to put it out on. The Cranley administration has become the enemy of people of color in the city of Cincinnati, and this must stop. I'm Charlie Winburn, and I'll prove this down.
I'd like to welcome our last speaker, Neil Craig.
I'm not as eloquent as that. I have no showmanship. But I have a loyalty. We talk about bridges that have been burnt and broken and torn up. But with the health gap, we have built bridges. I think we, the members of Kappa Outside Fraternity Cincinnati Alumni Chapter, has engaged itself with a partnership with the health gap. And they told us what the problems were. Infant mortality in the African American community and African American men's health. And let me tell you, we talked about that quite frequently among men, among the members of this community. And we found out that African American men, through the health gap, didn't care about their health. They weren't really concerned. Where the health gap was concerned, and the infant mortality in the African American community was outrageously high.
Yeah.
Well, most of my black men didn't know that. So we took the message to them through the health gap. We had forums all over the city. We met with churches, met with congregations, and we found out that African American men do care.
Yeah.
They care about their babies. They didn't know they were dying that fast and that frequently. But we did find out through the help with the partnership with the health gap that this problem can be eradicated. At least we can put a dent into it. Prior to now, No one talked about it.
Yeah.
Particularly African American men. Did a lot of things we shared with them in those different forums that the health guy gave us opportunities to talk about that they just didn't know. So with that, the care of the White Tillery and the health gap, we were able to disseminate information and ideas and concepts and other thorough things that made us more aware of what our challenges are in our health. With that, we reached over 700 men, African American men, that normally wouldn't have been contacted or talked to or reached to look at this grave situation of African American men's health and also infant mortality. So with that, I stand in support of the health gap and its efforts to, again, provide those services to our community. Thank you.
All right, we'd like to thank everyone for attending this evening and hearing about the health gap and the issue and coming to Avondale. Please, we look forward to continuing the engagement and would appreciate your feedback and support. As there is a Wednesday. At what time?
Wednesday, Wednesday's a council meeting, and that's when the decision's gonna be made as to whether we will have a budget. We would love to have you come, bring your friends, bring your family, bring people who care. Be at City Hall at least by 1 o'clock if you intend to speak. Before you can speak, you have to fill out a yellow card, and they will be available for you. But if you're there after 1:30, you won't be able to speak, you can still be able to attend. But I would like you to come and speak. This city needs to know that the Center for Closing the Health Gap is not located in some little corner somewhere where nobody knows who they are.
Right.
The health gap is big because it understands partnership, because it's centered in the community, because they have a way to reach people. And remember, the health gap has been talking about things that people didn't really pay attention to. It's popular now to talk about infant mortality. It's popular now to talk about prostate cancer. It's popular now to talk about food deserts. It's popular now to talk about how necessary it is to get checkups. But ladies and gentlemen, if we lose this institution, our community stands a chance of moving backward instead of forward. We have the worst healthcare outcomes compared to some third world nations. Avondale, surrounded by hospitals. Walk a block in any direction, and you can see the need. Please come Wednesday. Please come and speak. But more importantly, come and support the Center for Closing the Health Gap the way it has supported you. I've also been asked to tell you, if you can't come but you want to be a part, don't forget to call and email your favorite council members. That's right. Make sure that they do your bidding. And don't feel bashful about that, because other people do it all the time.
That's right.
And you know what? We respond. Now, I'm termed out, so nobody can do anything to me. But there are going to be some people running pretty soon trying to get your attention. And you need to make certain that they're going to address the issues that you find important. And if you don't care for yourself, care for your loved ones. Care for the people who can benefit from the Center for Closing the Health Gap. And remember, they got formed because the hospitals recognize that there is a gap in the service they can perform. And the Center for Closing the Health Gap does everything it can to fill that gap. This is not about the White Tillery, and I love my brother. But this is about our community and our health and an institution, the only institution we've got, that does the work that the health gap does. You gotta show up. You gotta come out in numbers. You gotta make this city understand that Mayor John Cranley cannot declare war on us without, in fact, having a war on his doorstep.